Good afternoon. This is the Board of Health for Thurston County for February 14, 2017. I'm Commissioner Bud Blake. I'm the chair of the board for this year. I'd like to start off by doing introductions. To my left, we have Commissioner Edwards. To my right, we have Commissioner Hutchings. To his right, we have the clerk of the board, Lydia Hodgkinson. To her right, we have the interim Public Health and Social Services Manager, Art Starry. And to his right, we have the Dr. Wood, who is the health officer for Thurston County. With that in mind, I'll call the meeting to order, and I'll ask for the approval or motion for approving the agenda for February 14, 2017.
Mr. Chair, Chairman, I move to approve the agenda.
I'll second that.
It's been moved and seconded to approve the agenda for February 14, 2017. All those in favor say aye.
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 Aye. Motion carries. Okay, with that in mind, I'll take a motion for approving the minute meetings for November 8th, December 6th, and December 16th, 2016.
Mr. Chair, I move to approve the meeting minutes from November 8, 2016, regular meeting, December 6, 2016, public hearing, and December 16, 2016, regular meeting.
No.
Am I allowed to second that? Because I
No,
was
you're
not
only
here?
second the November. No, I will do those. I will approve those myself.
Yes.
And
that's
recognize that those were approved back for last board. Okay, so we got that out of the way. So the next item we have is for the opportunity for the public to address the Board of Health. And so I have the sign-up roster here, and so I'll ask Lydia to explain the rules as far as the time limit.
Okay, I'll start the timer. You'll have a green light for 2 minutes, yellow for 1 minute, and then when it goes red, you'll have about 15 seconds. So you have a 3-minute total.
With that in mind, I have Tony Tabor. Is Tony Tabor in the audience? Yeah, come forward, ma'am. Yeah. How are you doing, Tony?
I'm doing fine. How are you all?
We're doing great.
I thank you.
Thank you.
We want to hear what you have to say.
I'm just going to read this. My name is Tony Tabor.
Sure. Can you pull the mic down just a little bit closer?
Okay.
There you go. There you go. Cool.
that
Good,
better?
good. Yeah.
Okay. I'm a nurse, hospice nurse with Providence Sound Home Care and Hospice. I've worked for Providence for about 18 years in our community hospice and home care programs. I'm also a member of our SEIU 1199 Northwest bargaining team in contract negotiations with Providence at this time. I'm here on behalf of the 140 caregivers at Providence Sound Home Care and Hospice who work hard every day to provide great care. We're proud of the work we've done to help Providence to become successful. We are very concerned that we cannot stand by and let Providence make short-sighted decisions that will hurt our families and our communities. At this moment, below standard pay, seriously deteriorating working conditions are jeopardizing our quality of care. The agency cannot recruit nurses or social workers with the current low pay scale. Registered nurses, aides, social workers are paid 18 to 26% less than group health home care workers, for example. We are losing experienced home care and hospice caregivers, and that experience makes a huge difference in the lives of the most vulnerable in our community and our loved ones receiving hospice and home care. Staffing levels are often not adequate to care for patients. Management does not take into account factors like travel time, team meetings, new and readmissions, and resumptions of care in scheduling, creating pressures on frontline caregivers to cut corners with patients. We are fighting Providence adequate staffing for patients, and to date they have shown little interest in making improvements. Providence continues to prohibit SEIU Healthcare 1199 Northwest members from supporting our coworkers at the bargaining table through PTO donations. This makes bargaining unnecessarily more contentious and protracted. Providence talks about stewardships of our resources, but there's a real question about their priorities. Providence made a profit of $303 million in 2015 and has paid their local hospital CEO, I'm going to slay this name, Madris Coluccio, an average of $1.2 million a year over the last 3 years, but they are cutting corners on staff time dedicated to important patient care issues, like wound care, which often requires extra time and therefore more staff. At this point, we feel we have no choice to bring our concerns to the community. We are more committed than ever to working with management to reach an agreement that will move Providence Sound Home Care forward in a positive way, and we ask the board to use your influence by calling on our management to move towards that end. Thank you for your time. I appreciate you listening.
Thank you for your words, ma'am. Okay, I don't see anybody else who signed up, but just in case anybody in the public would wish to come to the podium to address the board, we would like to have you. See nobody. Okay, I'll move on to the next item in the agenda, which is department items. And so today, item number 3 is department items. We have Thurston Thrive's action team. So Thurston Thrive has approximately 8 action teams, housing action teams, food action teams, but today we get to hear from Liz Davis and maybe Meg Sullivan on the early child and resistance action team, right? Hi, Liz. Yeah.
Commissioners, I'm Liz Davis.
Pull the mic up just a little bit.
Community Coordinator for Thurston Thrives, and today you will have the opportunity to hear from Megan Sullivan, who not only is the Executive Director of Together, but also is the representative on the Coordinating Council of the Child and Youth Resiliency Action Team. In 2013, when Thurston Thrives was founded, at that time, the Child and Youth Resilience Action Team was kicked off at the Community Summit on Resilient Children and Resilient Communities that was sponsored by the Junior League of Olympia. And on the 25th of February, this year's Community Summit will be held at South Puget Sound Community College at the Lacey campus. It's from 8 to 3, and registration is available online at jlolympia.org, and that is held in partnership with Thurston Thrives for, 2013, 14, 15, 16, 17, 5th straight year.
Oh, wow.
So very excited about
roll.
that. And it's free to the public. Free childcare is available with registration, and meals are provided as well. Megan will speak to you today about really 3 teams that have become one. In 2013, 10 Thurston Thrives action teams were founded. There was an education team, a child and youth resiliency team, and a community resiliency team, which in 2015 merged because of their considerable areas of synergy. So I'll leave it to Megan to tell you all about what's happening now.
Yay. Hello, Megan. How you doing?
Hello, I'm well, thank you. Thank you to Liz for that introduction, and thank you for the opportunity to address you all and share what the Education and Resilience Action Team of Thurston Thrives has been up to. We've been up to some great things, so we'll advance right into the next slide. Right here. Here we go. Just getting oriented here. So Liz alluded to some of the history of the Education and Resilience Action Team. It has a rich history in this community. For those who've been in social service a long time, they might remember a group called Partners. It was Partners for Children, Youth, and Families. It was connected to Drug-Free Communities grant work in this community. And then later it was called Thurston Council for Children and Youth. After that, Thurston Council for Children and Youth, or TCCY, merged with the Child Abuse and Neglect Task Force, and at that time it passed from Together, which is the organization I represent, to county leadership about 4 years ago, chaired by then Commissioner Romero. And since then, as of last year, we have merged, as Liz had alluded to, 3 action teams. So the Child and Youth Resilience Action Team, the Education Action Team, and the Community Resilience Team. And although it's a terrible acronym, we are the ERAT, Education and Resilience Action Team. I know there's some other bad acronyms out there in the Thurston Thrives world. All right, so what you see here in hard-to-read form is the strategy map that has been updated as of this past fall. Updated on it are the vision and goals and just some refinements to objectives and strategies. And the reason why we needed to revisit is we had an earlier map that did not reflect the priorities of the 3 teams that had merged. So what's new there is our vision as of fall 2016, that we live in a thriving community where individuals of all cultures are healthy, safe, valued, engaged, and successful. And what you'll see next as you move from the right side of the map inward is 2 goals. One is to increase protective factors and reduce risk factors in individuals and families. That's based on stellar nationally accepted science that started out of the University of Washington about 30 years ago. And goal 2, every child enters kindergarten ready to learn, completes high school, earns a post-secondary credential, and has the skills to find living wage employment. So as you can understand, these strategy maps for all these action teams are a snapshot in a moment in time. So, you know, it's the best work of our team as of last fall. Our top priority as of last fall, our group looked at, this is a big elephant to take a bite out of. If we were going to take just one bite, where would we want to start? And we did pick a top priority, which is new, and that's early learning and kindergarten readiness. So we're excited about that. Other active areas of focus are the integrated services work group. We have an active work group in that domain, and then engaged learning. So integrated services has a heavy focus on K-12 education, and we'll reference an actual project and what that looks like a little bit later. Engaged learning has a heavy focus on science, technology, engineering, arts, math, and career readiness. So talking about what's being measured and how we can tell when progress is being made, we broke our measurement of success into 3 major buckets: academic success, social, emotional support and development, and child and youth resilience. So in your packet was a 2-page handout called Education and Resilience Action Team, lists the vision, mission, and goals. On the second page of that is detailed information about measures. I think it made it to your packet, although you're looking at me like maybe it didn't make it into your packet.
I see it in mine on my
You
computer.
do? I thought so. I looked. I thought so. I was hoping so. So if you want detailed information about what those buckets of measurement look like, that is a way to dive in. I do want to just thank Marianne O'Garo from Thurston County Public Health, without which we wouldn't have all the data that we have. And our team is lucky. I will say we have a lot more data than some action teams. So just to give you a snapshot look at what's one thing in the academic success domain, kindergarten readiness is a sub-area that we can look at and understand, and there are 6 domains that go into what makes a child ready for kindergarten. Also in that domain is 4th grade reading, 8th grade math, 4-year graduation rates, things like that. Snapshot of social, emotional support and development. I'm going to flip forward to answer that. And we'll come back to this. It's a little bit hard to read, but this is a snapshot of the data dashboard using Insight Vision available on the Thurston Thrives website. And this is an example of some of the social, emotional support and development and child and youth resilience data that's available. Some of this data comes from the Healthy Youth Survey, and that is taken every 2 years in grades 6, 8, 10, and 12. And we're eagerly awaiting 2016 data. It's not yet available to the public, but it should be available shortly, and we should be able to update this slide. And then child and youth resilience, one of the snapshot measures for child and youth resilience is actually looking at adverse childhood experiences, which is measured in adults. And an anecdote I have to share about that is some of our Thurston Thrives folks, including Liz Davis, recently went to a ACEs research conference just a couple of weeks ago in SeaTac and got the latest research about ACEs and are sharing some of that in our community. So that's really exciting. So this was the data snapshot that I showed you. And now we're going to kind of move into what does this actually look like? So I've given you some of the high level, but what's an example on the ground of work being done in a collaborative manner that's producing some results? And the area that we're going to focus on and look at is called integrated services, and we're going to look at the Tumwater Community Schools Initiative example. So who that is a partnership of Tumwater School District together, City of Tumwater, United Way, Thurston County Food Bank, CMAR, and countless others. And what it is a systems-based approach to looking at what are the barriers for kids to literally show up at school and stay engaged in school and graduate on time. And it can be anything from the way the school interacts with that student around an issue to they don't have shoes or they don't have a bus pass or they take care of a younger sibling and the bus leaves before they can get their younger sibling on where they need to be. So why we do this is to meet the social, emotional, and basic needs of all students, all the way through from kindergarten through graduation and post-secondary. And how this work works is using student academic and behavior data, so it's data-driven all throughout. The data is available to community schools managers that are working in the schools, and the staff in the schools and the community partners and the school district are constantly looking at data to say, what do these kids need? Let's have one-on-one conversations with the district level people, with the families, with the kids to meet their needs. And it's actually producing changes in the way systems work. So now we'll get to what that really means. An example of what some of the real needs are in Tumwater School District are actual physical, tangible items, whether it's food over the weekend or food during the day or help navigating getting onto the free and reduced lunch, which is helps people not be hungry so they can learn. So a little history about this and how it came to be. Before Thurston Thrives was a partner in this, Tumwater was doing work to look at graduation improvement and reducing dropout. And it was sort of a magical synergy that the education action team, which was now merged into this, was looking at a best practice model for how they could engage with schools and improve education. And they had selected the community schools model, which is a national evidence-based model for this kind of work. So Tumwater School District and together and the Education Action Team initiated a one-year pilot project in 2014. And since then, we have used this model to expand out, and some examples of services that are now possible that weren't possible before is mental health services in the schools. CMAR is, as an example, a partner that's delivering mental health services in the schools where kids need it. It was hard for kids to actually get out to wherever they were being referred to if they had a mental health need. So why not find out how we can get the services in the school to them? Another story of success from this is using a model called Check and Connect, which is to build healthy relationships between adults and kids. Through using this model, there was a student that was chronically absent, so we could look at data and say what's happening. But when this adult role model began to have a relationship and connect and check in with this young person, they figured out that the kid's main form of transportation to get to school was a bike, and the bike was broken. So the staff person mobilized around this kid, and this is something that schools wish they could do without a dedicated staff, but their counselors and their teachers and their administrators are up to their eyeballs in all the work they have to do. So what makes this model work is having a dedicated person. That person figured out how to get their bike fixed, figured out that they didn't have waterproof gear and that they didn't have shoes that were going to keep their feet dry, got some of those needs met, and now that person did get on free and reduced lunch through the relationship, did connect to a pantry. The pantry is a place for clothing, school supplies, food items, anything you might need. So connected to the pantry and now has a healthy relationship with an adult. So if this program didn't exist, these kinds of things might not have connected with that kid, and that kid might not be in school. So that's kind of an example of a story of impact, and this model is something that other school districts are paying close attention to. There is expansion. First it was only in middle school, high school. Now it's in elementary school in Tumwater, only in 3 sites, and there's a continued interest in growing it. United Way has been talking a lot about it and is excited about it too. So other things that are exciting about the work and other areas where we have active work groups and teams doing neat things are in the engaged learning realm. So Education Service District 113, Thurston Economic Development Council, the County Chamber, school districts, the Y, and the library are working on the engaged learning piece and enhancing career readiness. And what that looks like is working to make a plan. So they have some funds just for planning, and they are producing a plan. So they're looking at data now to produce a plan to say, how do we do more science, technology, engineering, arts, and math in our community? That work group is chaired by Wes Pruitt, and the next meeting is Monday, February 27th from 3:30 to 5, and they're meeting at the Thurston Economic Development EDC office. And they will be going over data collected from career and technical educators across the multi-county region, and this work is connected to a regional approach. And I think I missed one. Did I miss one? No, I didn't miss one. So those are some examples of some of the work that the Education and Resilience Action Team has been up to. As Liz mentioned, we're also connected with and a partner to the Junior League of Olympia Summit coming up on the 25th at SPSCC. So if you have any questions, I'd be happy to try to answer them.
Any questions?
No,
Oh, yeah.
I got thousands, so, okay.
Yeah.
All right, we'll see if I can answer any of them.
Your first thousand.
I was going to ask how you measure the social and emotional support and development of the children or child youth resilience, but I see at the end of this slide presentation, you have your measures in there. So thank you for that.
Yeah, so the data sheet,
Yes.
what the measures are. This is just a one-pager, but any detailed measure question, I would defer to Mary Ann.
Okay. And I don't know if you said it or not, but you referred to ACEs. So for members of our audience and/or for the people watching on TV, can you explain ACEs, what that acronym is?
Yes, it stands for Adverse Childhood Experiences. It's something that's measured in adulthood, and it's retrospective, looking at a young person's upbringing. And some of the examples are a parent who is incarcerated or witnessing domestic violence in the home. There are 10 of these, and there's great research that shows the more that someone has a higher ACE score, the harder time they are going to have with health, physical health, social, emotional health, and other factors.
And the greater likelihood they'll come into contact with criminal justice.
Yes.
Yeah, it's fascinating research. When we talk about, as the Board of Health, the overall health of our county and our people, this Education and Resilience Action Team, what you've just set up just really speaks to the mission statement and the vision as well of Thurston Thrives. I'm very happy about this. So that's not a question, it's a statement.
Well, thank you. It's a whole team, and there's a whole bunch of people working hard every day and who've been passionate about this and committed to it for so many years. So I will pass on those kind words.
Please do.
He stole some of my questions, so I'll just reduce it a little bit. And you mentioned the whole team. That's where I want to go. Can you talk a little bit about is it the ERAT team? Is it best to say that? Okay. And
Yes.
just who are the members and how often you meet and kind of, I'm sure there's an action arm. You just demonstrated that by the Tumwater School thing with the integrated services. But is it networking? Is it a hub? Just kind of walk us through what the ERAT is, what the life of an ERAT does.
Yes, so ERAT is much more of a hub than like a monthly meeting. Historically, it was a monthly meeting. It has moved to less frequent meetings of the larger team. We have an email list of 80-some people, I think.
yeah.
And any given time, there's 20 or 30 people, I would say, that come to a meeting of the hub. And then those action teams that are working on a variety of projects, everything from helping out with the Junior League Summit to working on the STEAM plan, those have anywhere from 5 to 20 people on those dedicated work groups as well. And we are in sort of a transition phase from meeting, I think, every other month last year. So it was monthly a couple years ago. Then it was every other month. And now we're moving to a quarterly meeting for the hub and a lot more frequently, like monthly, for the work groups. And so if it's not already up on Thurston Thrive's website, I will check and make sure that we get updated information about when each group meets. And the staff person is Jessica Bateman at United Way, so anybody can direct staff questions to Jessica.
So just to kind of recap, 2-3 years ago, it was 3 separate teams. Now you formed the ERAT, and then from there you've kind of spread out the times you meet. So all that transition, you still come up with these goals and objectives and measures and making a difference. Schools, you mentioned Tumwater School. Is this just an example? Is this something you're going to do, have done as far as the Tumwater, and are there any other schools involved?
Yeah, really good question. There's interest in expanding the community schools model out. It was a pilot project in 2014 and has grown steadily every year in the Tumwater School District. I should have said this, how it's funded is 80% of the money comes from the school district, roughly, and about 20% of the funding for that work comes from the Community Investment Partnership, which is local jurisdictions, and United Way money. So it took a significant interest, readiness, and commitment and literal buy-in from the school to make the Tumwater project happen. There are other schools in county and out of county that are saying, however we have to fund that, we want to have that, and we're willing to look at what it looks like. But there's no school that's poised and ready, no district that's like absolutely 100%
Bring
has
it
a
on
plan.
kind of mode? Okay, sure. Last question. So this is the ERAT we're talking about. Is there any movement to talk with the food action team? That would be the FAT, but that's not what I want to go with that. But is there a nexus between the two as far as putting the kids and food together, or we'll even do the housing action team? I'm kind of biased at it, but and go in that direction, yeah?
Or clinical and emergency
There
care.
you go. There's another one,
So
sure.
there's been some great work that other folks have led, including yourself, to bring together the nexuses to
Yeah.
talk about where the intersections are. And I think that's a ripe opportunity for our group. The other ripe opportunity is to do some strategy measurement work. We've got our overall data measures, but how are we measuring the strategies that we're doing? So I think those are going to be on the book of business coming up.
Oh, book
But
of-
so
I like that.
far,
There you go.
there's
Okay.
not a plan for it, but it's
Okay.
something that's definitely on our radar.
Something we can try eventually, right? Yeah,
Yes,
sure,
we would love to.
Yeah, absolutely. Any other questions?
No,
Oh.
good.
Megan, you're spectacular, and thank you for what you do for the Thurston Thrives ERAT team and for the community as a whole, and look forward to more.
Thank you for your interest in
bet.
ERAT's work
You
and for
bet.
your leadership.
All right.
And Liz, too.
Oh, and Liz, oh, yeah, absolutely, Liz.
Anything else?
Yeah, yeah.
I would just say that the question that you had, Commissioner Blake, about those intersections between food and education and resilience, those are some conversations that are happening at the food action team level.
Oh, good.
Because they do definitely recognize that in order to be ready to learn, kids have to be
Yeah.
not only not hungry, but
Yeah.
that they have to be eating good, nutritious
Yeah.
food. And so as they're thinking about some of their focus areas and also some of their message points, those are very much on the minds of those team members as well.
Fantastic. I mean, Oreos are great, but carrots are better, right? Is that what-
Yes, very true. And
All right.
local carrots.
Yeah, there you go. Okay, so the next item we have on the department item is suicide awareness. And so today we've asked Mr. Gary Warnock, who's the coroner for the Thurston County, and Mariana Aguero and Duncan McQuarrie, is that how I said that? Great. To kind of come forward and talk to us about suicide here in Thurston County. It's a whole range of topics from prevention to intervention to awareness to education, and I call. You're going to do the introduction, Chris?
I'm just going to prepare the
Oh, good.
PowerPoint
Okay.
slide for
You
our
usually jump
coroner
up there.
and-
Okay, so Gary, you want to come up here and? Just setting it up. There we go. Super duper. Take it away.
Okay, thank you. Good afternoon. Again, my name is Gary Warnock, and I'm the Thurston County Coroner. And I'm going to discuss a very difficult subject, and it's on suicides. I'll apologize in advance if this affects anybody, but I'm a survivor of suicide myself, and I'm sure there's people in the audience who have been affected by suicide. Before I get into my PowerPoint, I'm going to explain. Basically, it's a 10-year approach, is what I looked at. Back in 2006, Thurston County investigated 26 suicides. In a 10-year period up to the end of 2016, we reached 53 suicides. So basically, it doubled in numbers. And when you look at it, our population didn't double in 10 years. And what it boils down to is a couple things that we looked at in our investigations is that in a 10-year period, we as a society, we were fighting two wars. So in our numbers, there were many veterans, active duty soldiers who were not able to get the treatment that they needed or desired. We had a major pain clinic that shut down in Seattle. So some of the patients weren't getting their medications when needed. And mental health was another big one. And just relationship problems as far as domestic issues. People lost their jobs, the recession. They were no longer the breadwinners of the family, and it just spiraled out of control. So all those people fed into this funnel, and that's where we pretty much came up with the 53 suicides. There were probably a half a dozen or so that could have been put in that category, but as investigators, if we're not 100% certain that it is a suicide, it'll be deemed undetermined death. So we can only have one manner of death. So if we can't go with suicide or accident, we go with undetermined. And so we had a half a dozen of those that could have very easily fallen into the suicide category. I took some numbers. It's a handout that I passed out here to you and the folks here. These were actual raw numbers that were called into our 911 center. And if you go all the way over to December, those numbers are, it's an average because those numbers weren't available during the time of this write-up here. Oh, this is not on the slide. Yeah.
Right. Gotcha.
So if you look at attempts, those are actual attempts to where EMS was actually dispatched to these homes. So 9 in January, 15 in February, and so on and so forth. Threats were people where they had just called in and maybe said, I'm thinking about committing suicide. So if you look all the way over to the far left or the right, the total there was over 192 attempted suicides just here in Thurston County, and over 1,000 were threats, with a total of 1,190 that were totally called in. Let's see here. Okay, on my slide here,
Yep.
can you see it from back there?
Yeah, we see it.
Okay. So this is a breakdown of suicides by month. 3 in January, 5 in February, 3 in March, 5 in April, 7 in May, 1 in June, 8 in July, 2 in August, 7 in September, 5 October, 4 in November, and 3 in December. Let's see, the average age, male was 49, average for female was 43, and the range in the males was between 18 and 75 years old. Female range was 20 to 69 years old. Mode of suicide, 23 deaths were reported as gunshot. 21 of those were male, 2 were females. Oh, sorry.
Oh, I see where you're going.
We there now?
Yep.
Okay, sorry.
No, you're good.
8 were overdoses, 3 were male, 5 female. Self-inflicted stab wounds, 3 male, 1 female. I'm sorry, 1 male, 2 female. Drownings, there were 2 total drownings, both were female. And carbon monoxide poisoning, both were males.
Right.
And that's a breakdown of our suicides of the 53. And as far as ethnicity, 45 were considered Caucasian or white, 3 Native American, 1 Hispanic, 1 Asian, 1 East Indian, and 2 other unknown. And that's on the death certificate, it says other, and we can't, it's either Pacific Islander or whatever the family may have chosen, so it goes as other. And as of to date, we've had, for 2017, we've had 5 reported suicides already just in Thurston County.
Wow.
And on your chart, on the one that was passed out, if you look at the correlation of numbers, our high month as far as suicides, July being reported, or actual 8 suicides for the month of July. If you look at the graph on July here on the handout, there were 27 attempts. And if you look across left and right, that was the highest number also for suicides for us and attempts, but not as threats. So, and I've always said that for suicide prevention, awareness, I don't think you can ever do enough. I know there's pamphlets and handouts at schools that can that are readily available to our students, but I don't think as a society we can ever do enough to prevent suicides. So, any questions?
Yeah. Any questions there?
Gary, on the one, the tall column, it was 45 whites and then a small amount from other demographics.
Yes, I got it.
How does that compare to the county's demographic as a whole?
I can't answer that one.
Okay, we can get it. I bet it's probably close, but yeah. I was just curious. Okay.
To compare demographics, that's your question? Okay.
Yeah, just You know, you mentioned racial component.
Sure.
I just wondered how it was made up.
Okay.
Okay.
You have a question?
I have a question, yeah. Regarding suicide, well, obviously regarding suicide, you mentioned the closure of a pain clinic in Seattle. And did they see a spike, did you say?
There was correlation. I can't speak about the spike, but there was correlation just by, through our investigations, that some of our decedents weren't able to receive their medications because the pain clinic had closed, and that was their source.
And 'cause I've heard over the decades that one of the factors in someone choosing that as a means to end their life is because of chronic pain. And I'm going to presume that's factual because I don't work in that world. But do you think since medical marijuana has been outlawed in Washington State, that will have an impact with? I'm just asking you to speculate at this point.
Yeah, I have no idea. I know that the suicide cases that we investigate, every suicide case is difficult to work just because of the nature of the tag, the label that it carries as suicide. There's denial when you meet these families because generally the response is there's no way that their loved one did this. There's no way. We would have saw it coming, or someone else has done this. Suicide notes aren't always left at suicide scenes. As investigators, we love to find those notes because it's an authored letter by the individual stating what had happened, and in some of those cases, it details chronic pain.
Yeah, I'm just thinking out loud. Thank you, thank you, Gary.
Okay, I got a list. So, couple things here. Not enough. I totally agree with you. There's not enough information you can do to prevent, awareness, all those things to help out. But looking at kind of from a reverse mirror image, if you will, are there things such as TV and other social, I'll say medias, other peer pieces that cause this that you've seen in terms of as more like a gateway or assistance to people do it? Is there something, I'm just trying to get inside your head because you're much more closer to the numbers.
I've only seen one. It was like a copycat type.
Yeah, that's what I'm trying to say.
Yeah, copycat. And it was several years ago, and it was a young female student, basically, and someone else followed in her footsteps because they saw the way that she ended her life and how people reacted, and she just thought that was okay to do, and she followed through with it. So that's the only one copycat that I can think of.
Can I speak to that real quick?
Yeah, sure.
And recent research, I'm not sure how recent it is, but recent research talks about connectedness. So when you're talking about a copycat, someone has a connectedness to somebody else, or a lack of connectedness where someone's completely disconnected with other people or family or society. And that plays I would imagine, Doctor, you can speak to that.
There is a connection. I know that in some of our cases, there's anniversary dates where, say, a dad or a grandpa committed suicide 20 or 30 years ago, and then when you're doing your research, you find out that this person committed suicide on the same date as someone in their family did. So there's some timeline there as well.
Doctor, do you mind?
No,
I
this is
just
what it's all
wanted
about.
to say I had the honor to serve as the physician for students at the Evergreen State College for 12 years. And I would say that the lack of connection or feeling like they were part of a community was a factor, and certainly in the depression that I saw. And so that's why it's really neat that Thurston Thrives is doing the childhood resilience and community resilience in education.
Good
I mean, that's sort of going upstream to see what you can do to prevent some of this.
You're marvelous. That's a good connection. Yay.
Yeah. Thank you.
Two more questions, and I don't mean to get geeky on you, and I don't mean to put you on the spot. From 15 to 16, I was here last year, and the numbers were absolutely horrible then, and I cannot remember what they are for
48 last year.
Yeah, and now here we are.
I'm sorry, for 15.
For 2015, the year 2015, there was 48. In 2016, we're ending with 53. Is that correct?
Correct.
Oh my God, that's horrible.
So it's just it's a steady incline.
Right.
Correct.
Okay. So I want to jump to your slide, the first slide with all the bar graphs on there, and the very first one. There you go. And maybe I'm getting too much in the weeds just because I'm super passionate about this. June obviously is for the lack of whatever, success in terms of just one. I'll take that, right? Even though I don't want to miss one person. But what happened to get to 8 and from 7 to 1 to 8, the month before to whatever? Or is this an anomaly?
It's like this all the time.
Is it
People
really?
will ask us as, you know, do you see more suicides during the holidays?
Right.
For us, it's always like this.
Year, month to month.
Yes. And does have nothing to do with holidays, summertime. In the summertime, we may see more traffic deaths and more drownings, but as far as the suicides, it's always like this.
Mm-hmm. Okay, I'll take that answer, but
Yeah, sorry.
I know, it is what it is. I just want to see how the numbers help us out and the storylines behind helping with kids, and just want to get ahead of it, obviously.
I
like
can do
anybody
a
else.
graph with the, previous years that lead us, so you can just like do an overlay to see if there's if it maintains that same curvature
Oh,
type.
rhythmic paddock, yeah, okay. I'd like to see that for 2015.
We
Okay.
got more when you're done, one more.
Yeah,
when you're
sure,
done.
go ahead.
Last time we met, a week or two ago, and we spoke about this coming up, subsequent to that, I contacted the lead person on our county Medic 1 critical incident stress debriefing team, and asked them to reach out to you and your staff to do debriefings on your staff, because not just on suicide, but on all manners of
Traumatic, sure.
death and all ages. I hope that happened.
She did reach out.
Yes.
Thank you very much. Yeah.
Yes, good, okay, good. And please do what you can to take advantage of that.
We will.
For your staff. Wonderful, thank you. I'm
I appreciate your
a firm
concern.
believer in that.
Commissioner had talked about what kind of debriefs do we get.
Oh, yeah.
And we just debrief ourselves. We talk about the cases that we've dealt with, and that's our professional debrief. And Commissioner was gracious enough to reach out to somebody that he knew to invite us to their debrief. So we're going to take him up on that.
Yes, oh, that's heartwarming.
Yeah, doctor.
I just want to say I'm grateful to Mr. Warnock, because he does go into the schools and talk
Does he
to
really?
students,
Oh, wow.
try to educate them about not texting and driving, and to take things seriously. Yeah.
Thank you.
Yeah.
Beautiful job.
Any other questions?
No, having dealt with it in another life, so to speak, for almost 40 years, I know it's a trying thing
Sure,
to deal
you-
with every
yeah.
day, and you dealt with it more than we did in law enforcement, because you were there at every one, so.
Yeah.
Anyway, hat off to you.
Thank you.
It's a tough
Yes.
one.
Yeah, same here, and thank you for the schools and your involvement. It makes a difference, and maybe you don't see it right up front, but it makes a difference.
I hope
It's,
so. I mean, personally, if someone can just say, yeah, I remember that guy who spoke at our school and changed my life, then that's all that matters, so.
Yeah,
Very powerful.
yeah.
Thank you, Gary.
Thank you.
Okay, thank you.
All right, so I'm going to ask next person. Are you going to introduce Chris, or you're going to change the slides on me again? Okay. Okay, so ask Marianne Aguero to come to the podium, and she's the Suicide Awareness Patterns and Prevention. She is the epidemiologist for Thurston County, and one of the best I've ever met. So, hi, Marianne.
I appreciate that. I'll just wait for these to pop up
Yeah,
real
it's
quick.
talking to the electrons. There you go.
Great,
Oh,
thank
yours
you.
are pink.
Thank you for having me today. I appreciate you
bet.
talking about this important subject. And as was mentioned, I'm an epidemiologist with the Public Health Department, and my role there is to look at health data for Thurston County, to look for areas of concern, to look for areas of improvement, something we call community health assessment, but also to respond to external and internal requests for data. And this particular area is a common request that we get. What are we seeing? What's happening? Also, depression, things related to mental health issues. It is one of the top things I'm asked about for Thurston County, and as you can see from Mr. Warnock's presentation, there's a reason. And so, in part of what I wanted to share with you is you were shown recent data, but I just wanted to reaffirm a couple things by showing you some data that is from the 5 years prior to 2016. And just mention some summary things that were emphasized before, but just to go to reemphasize. 2016 is very concerning. Obviously, that's why it was presented to you. 2017 is not going the direction that we would like to see. The previous 5 years were also concerning. So in terms of a decade pattern, this is something that is really important for the residents of Thurston County to have addressed. Suicide is the 8th leading cause of death in Thurston County. So leading causes of death are things that you are most likely to die from when you live here. Cancer is an example of one, heart disease is an example of one, and Alzheimer's is an example of one. And there are a lot of them, so being in the top 10 is a big deal. On average, prior to 2016, if you look at the 5 years before, 44 residents died each year. As you can see, that number in 2016 alone is different and is something that we hope does not continue to go down that path of increasing. One of the things we look at when we look at data is something that we would call a rate. Is Thurston County really different? What's going on here? We do something called a rate, where we look at Thurston County compared to other places. Other places can have a different age structure, different thing. Health issues are often affected by age, gender composition, different things. And when I compare Thurston County's suicide rate with Washington State, we're consistently higher. So that's a concern. So when you see all these things leading up, it's not a one-year issue. It's an issue that we really, as best as a community as possible in all our different opportunities to intervene and affect it, it's very important for us. Again, using that summary of the 5 years prior to 2016, just to give you a feel of what that looked like when all that data that came from the death certificates was combined in just a slightly different way of looking at it. Suicide deaths, 3 and 4 are men. Men are more likely to use a firearm. When you look at age, you'll see that about 4 and 5 are between the age of 18 and 64. But of course, some are younger and some are 65 plus. Suicide really, to make a difference in this, is a lifespan issue. It's important, though there's things that you can have higher rates at different ages. It's something that we really need to think about preventing and reducing across the lifespan. And when I looked at this particular set of years, the 5 years prior to 2016, Mr. Warnock gave you a feel for what we're seeing in terms of calls, those kinds of things. But on average, about 130 county residents are hospitalized for a suicide attempt that they did not die from. So that's kind of, your condition was enough that the hospital admitted you for care, though you did not die.
What's that number again?
130 on every year.
130? Mm-hmm. Oh, my word.
Mm-hmm.
Okay.
So when you look at deaths, you look at hospitalizations, you look at calls, it just says, this is a place we need to focus on, and people have been discussing and concerned about, which, again, thank you for talking about this today. It's a hard subject. As was mentioned in some of the questions previously, there's science behind this. We're lucky to have research. We have people looking at what we can do. Looking at what's an effective thing to do, looking at what's going to increase your risk for suicide, and looking at it so that we can take effective action. And this concept in public health and in other arenas is called looking at risk and protective factors, things that increase your risk for insert health issue, in this case suicide, or decrease your risk for that. And it's kind of a common framework you see from everything from chemical dependency to suicide to other health issues. And when you look at that and you use that framework, it helps you hone in on things that if you spend your time and effort, no matter who you are, faith community, business community, government, local school, you're going to have a better chance of impacting it if you understand this is more likely to cause that or this will reduce that. And for suicide, there's several things that have been listed which you hit on in your questions as risk factors for suicide that are more likely to be involved. You hit on it, illness and disability. Definitely, science shows absolutely that loss of physical functioning, health and well-being is a risk factor. It doesn't mean you will attempt suicide. It means you're paying other reasons you're more likely. Loss, relationships, financial, a range of loss. History of depression is another example. Child abuse. child maltreatment is on that list. And there's kind of different ones that relate to both individuals, families, and kind of community. So community like barriers to treatment. Mental health treatment can be one. But what I wanted to share with you a little bit is some of the short list of things that are considered protective factors. So protective factors are that no matter what you do or where you're at, if these are, if a community addresses these have all uniquely, individually, have the ability to make some difference and reduce risk for suicide. And every community, whether it be Thurston County or Mason County or any other place, has different levels of these things present or absent, and every community can decide what might be appropriate for them to focus on. But this list is a good list in terms of things to consider, making more common, more prevalent. And some of them include things, as identified, that are more about working with individuals. So improving skills in conflict resolution, conflict problem solving. You can see that with kids. I mean, that's what schools do, and a lot of people do. They work on helping them look at ways to deal with conflict and manage stress at earlier ages. And that's something that we have occurring in Thurston County, and we could have more of if that were so, where people desire to invest effort and time. Building connections, which you all mentioned before, that issue of connectedness. That's a lifespan issue. That's not just a youth issue. We have almost 100,000 residents who are age 50 and above. It's a lifespan issue for us to think about what connections look like and what social supports look like and community support look like, and no matter what realm we're working in, improving, making that stronger, making that more present. One of the other things that comes up a lot is having in your community effective clinical care and access to it. There is much work going on in Thurston County around these issues. Very, very impressive things occurring here. Addressing access to lethal means to suicide is one, and cultural and religious beliefs that discourage suicide and support self-preservation is one of the protective factors to prevent suicide. And all of these have been included in this. The state has a suicide prevention plan. They're found on the list. There are others, but these are examples of things that if we're looking at where people might want to do more, services, programs, awareness, some of those things will make a difference, and that's what research shows us. And so one of my presentation's pretty short because I'm going to pass it on, and you're going to hear a little bit about what Thurston Gun Sense has done around the issue of suicide and kind of what putting protective factors in play looks like. So.
Mary Ann,
Yeah.
I have one question.
Sure.
You're not going anywhere.
Yeah.
Sorry.
I don't know if this would be maybe for you or Gary, but
Oh, sure.
as you're compiling information, do you ever look into things like occupation, whether they're employed or not, maybe a history of illness other than mental illness, and maybe do they have access to health care? Are they involved in a recent conflict, like a divorce or civil issue? Do you record any of that information that might help you to assess threat?
Yeah, and so for Mr. Warnock has a unique view of unique circumstances. For the kind of work I do, whatever is on a death certificate is what I have access to. And so that wouldn't have some of the information that you're asking, because that's kind of where I pull my data from. But there are, we can always look further. We're always glad to look more to answer your questions too and see what's possible. So.
Okay, thank you.
Looking at the, where are you going?
Oh, sorry, I thought I was done.
Looking at the back of you. Looking at the protective factors and reducing the risk, you have restricted access to lethal, highly lethal means of suicide, and everybody goes right to handguns, and that's coming up next. But I just want to state that includes drugs, alcohol, knives, etc. And Megan's gone. And the work that Together is doing to limit the access of, especially of our youth, to drugs and prescription drugs. There may be legal drugs in the home, but not legal for them to take them, and alcohol. Tremendous work in that area over the
Right.
last
Right.
20 years.
Right. And
Very proud.
often, when you look at, if you were to, this is just one example, if you were to look at women, the second leading method is often what we call poisoning overdose. So you're absolutely right that there's many different ways to look at that and be aware, and that's a really good point. Yeah.
Anything else? Thank you so much, Miriam. As usual, it's very informative and great insight for better community health.
Okay,
period.
thank you.
Yeah.
Thank you.
Yep. Yeah, so next we have representatives from the Thurston Gun Sense Coalition, and I think this is Mr. Duncan McQuarrie. Is that how you say your name, sir? Yes. Yeah, how you doing there?
Good.
Yeah, Chris is going to line up your slides and we'll get you going.
That must be done.
Yeah. Yeah, if you go ahead and by introducing, is this
Good
Diana?
afternoon, and thank you for having us. And I'd like to introduce my wife, Diana. She's a co-presenter on this, or at least a designer of the presentation. And she's actually what got me into this. So
yeah.
we'll tell you about our journey. First of all, Di and I, both of us independently at one time, but together have lived in Thurston County for over 30 years. We're both longtime educators. We've worked, Di has worked in the Tumwater and Olympia School District. I worked in higher education in a number of places, and then for the State Superintendent of Public Instruction. So we've been involved with education, and when we retired, we thought, well, we just have travel and fun, and then we started on another journey. So Thurston County, or Thurston Gun Sense. Di initiated the work of this group. It started with Di's journey really as an elementary school counselor. When, thank you, Chris. Sandy Hook had a huge impact when that young man came to that elementary school and killed so many children and staff. Di was an elementary counselor, and she could imagine what it must have been like to be in that setting. So that really impacted her. And then our daughter works in the summers at an institution in Western New York. She's a musician, plays in the symphony, and several years ago, one of her colleagues, a very accomplished violinist, finished a performance, went home up in the hills outside of this institution, walked into her home, and there were two young boys in there stealing her home, and they had a gun. I forget where they got the gun, but they shot her and killed her. And that struck very close because we knew this woman. It was probably the first time we really knew somebody that had that effect. And then the last one that really struck hard was the shooting in Charlottetown at the church where a gunman came in and killed so many. And at that point, Di said, she's had enough. I've got to do something about this. And we're members of the United Church of Olympia. And she went to the minister and said, is there something we can do? And she said, of course. We have a group of folks that work on that kind of thing. And he said, we'll give you the space and the time to work, and you gather the people. And so we started off with about 8 people, and we were really focused on gun deaths. And we looked at data, we tried to find information, and finally we said, we need to find somebody that has information about that. We thought, well, Thurston County, the health department probably has some statistics about that. And guess who Di contacted? Of course, Mary Ann. And she said, yeah, I have data. And she gave us reams of data that had come from the State Department My background is a data guy, so she gave it to me and said, you know, look at this stuff. And it was just striking because when we looked at it, over 80% of the data at that time, over 80% of gun deaths in Washington were suicide. You know, what we hear about are somebody gets shot, killed in the street and everything, and that's the big story. That makes the headlines in the paper. But we were just blown away, and so we shifted our folks from a broad view of gun violence and said, you know, if we want to make a difference, we should focus on suicide and suicide prevention and intervention, and that's a ripe area to reduce gun violence in our community. So in the spring of 2016, our initial small group expanded to about 40 individuals representing agencies and organizations throughout Thurston County. And they represent a diverse group, and you can see various agencies, including Thurston County Health Department and the Washington State Department of Health, and both Chris and Mary Ann have been very helpful to us, and we appreciate their work on our behalf. There's individuals from local faith communities, the League of Women Voters, YWCA, Veterans Group that you've already heard about, a large group. There's an active group in town that addresses suicide amongst veterans, and they're part of our group. The Office of the State Superintendent is interested in terms of having programs in schools that can help prevent it. So OSPI is represented with this. Mary Ann represents Thurston County Health Department. The Educational Service District has a representative on it. And both Mary Ann and the Educational Service District working on training programs for us. So here's the vision for this group. We envision a future of Thurston County where our culture delegitimizes violent use of guns, and our state laws and local ordinances reflect and support this. In our work, fostering connectedness results in a caring community, celebrating diversity, mutual support, and peace. The mission is simple: working together to prevent gun violence in Thurston County. And what we're focusing on, as I mentioned, is suicide, because it's just such a big part of the suicide. So other leading tools in the county and the state, and you've already seen other data for Thurston County, but in 2015, 25 people died as a result of firearms. 21 of those 25 were suicides. 3 were homicides and 1 undetermined. You saw that from the coroner's results of just this disproportionate representation of where these deaths are coming from. And these data, that is converted to percentages, are very similar to state-level data. So recognizing this, Thurston Gun Cent is having a strong focus on suicide prevention. And just another note, between 2010 and 2015, 135 or 55% of the county residents' suicide deaths involved firearms. And again,
Could you say that again?
right, it's between 2010 and 2015, you take that time period, of the 135 deaths, 55 of those were suicide. And with firearms.
Firearms, yeah.
So our areas of focus are to provide suicide prevention, education, to create a gun-safe community, to reduce stigmas and fostering connectedness, that is, helping families who have experienced suicide, as well as I'll get it yet, Chris, as well as individuals who are considering suicide. As you can imagine, this group now big, 40-some people that are kind of real active, and then a whole other group. So some of the activities that we've engaged in, we've hosted, we plan on hosting more film events, but we've had one, Carrie Couric's documentary, Under the Gun, very powerful statement on gun violence. Joining community members in the annual Out of Darkness Suicide Prevention Walk at Marathon Park. We worked hard on promoting Initiative 1491, the Extreme Risk Protection Order that passed by the people this last period of time. One of our members, I don't know where she got all these gun locks, but she has a never-ending supply of gun locks that we pass out whenever opportunity we have to folks that might not have such a tool to keep their weapons safe. We're planning a series of mental health first aid sessions, and that's a joint effort from the EST 113, and Marianne is working with us on that project as well. The other connection, and just a small footnote, when Marianne gave us the data from the State Department, the Health Department, I looked at it, and here the author of it was a Martin Mueller. I said, Martin Mueller, I worked with him at OSPI, and I didn't realize that he had gone to the Department of Health and was involved in this effort. But Governor Inslee, with Executive Order 1602, created an effort at the Health Department of firearm fatality prevention, and approaching it as a public health approach. And in looking at it, because of the data, that approach was narrowed down to addressing suicide. Again, as we had, it's the richest source of reducing deaths by gun. So the statewide suicide prevention plan, and Teresa Hansen from the State Department of Health briefed our group on the statewide suicide prevention plan. And that activity associated with it is the Action Alliance for Suicide Prevention, which is a statewide group of professionals in all areas that are approaching this, and they're implementing the statewide plan. And this alliance meets quarterly, and I'm fortunate enough to serve on that group and learn a lot about, again, just listening as we did here to other areas, the number of people that are working on these kinds of issues. I had no idea how many people around the state in all different areas are working on this, and the governor's program is taking care of that. And we'll just close with this one. So thank you, and I'll answer any questions if you have them.
Thank you, sir. Any questions? Yeah.
I don't know if I've got a question as much as a statement. I have to say thank you very much for your effort, Duncan, in solving a very serious community problem. I guess what I would ask, if you have some of your meetings and discuss this with some of your folks, it seems that it's often easier, or easiest, I guess, to have facts that are directly related to a tool, like the gun, for an example. It's not as easy to come up with the why. And if we could focus more on the why, not that what you're doing, the gun issue, I agree with you, it's a big issue, it needs to be looked at. But the why portion of that, I mean, and there's a lot of speculation on why. Is it, you know, is it Hollywood and all the craziness in the movies? Is it the Grand Theft Auto games that kids play? I don't know what it is. Is it music? I don't know. It's not. So I would just ask that you broaden your perspective, and maybe we can come up at some point with the why. And I know Dr. Wood had mentioned that isolation sometimes affects kids, and so if we can quantify some of those things that we can quantify, it's hard to quantify the why, I realize that, but if we could focus more on the why, I won't say more. If we could focus on the why as well as other major components of this problem, I think maybe we could make headway.
I agree, and that's a good suggestion, and I'm sure we'll take that back and ask people to help us with
And
it.
we do applaud your efforts, and thank you very much.
Well, thank you.
Mr. McClory, when I look at the Thurston Gun Sense areas of focus, you have you've listed reduce the stigmas and foster connectedness, helping families who have experienced suicide, as well as individuals who are considering. Do you have support groups, or how do you go about doing that as an area of focus?
Well, it's encouraging people to engage in that activity. And Di, I don't know if the one about supporting.
Yeah, supporting, it's up on the screen
Stigma.
now.
Right.
Helping families who have experienced suicide, how do you do that?
Well, we did a number of those activities that we listed, like the Out of the Darkness Walk,
Okay,
which is a very powerful walk supporting people who have experienced suicide within their family or friends, as well as people who have attempted suicide themselves, and that's a big community effort. We've supported the 20 veterans group, 22 Too Many. One of the founder of that is a part of our group, and we've participated in activities to support veterans so that they don't feel as isolated, and we've joined up with them, and Patrick Seifert, who leads that, is part of that. We've also have a number of diverse groups. There's a group called Pizza Clatch, which supports students, LGBTQ students who are very prone to suicide or thoughts of it. And one of their members, or the leader of that group, is one of our members. So we've tried to encourage a very diverse group. Duncan mentioned there's also faith leaders. One of the members of the social network at the Islamic mosque is a member of our group. And so he takes back information from our group. That's a communication kind of thing. And we have interfaith people who have supported them during what has been a scary time for many Muslims. We have the rabbi from the synagogue who is a member, and then a number from Christian churches. So each of these people represent the other groups, and we are working very much together on what you were talking about, is the connectedness, the mental health first aid groups, which Marianne and Sarah Ellsworth from the ESD 113 are putting together, are so that people learn the tools to talk with people who are thinking of suicide. And for instance, just from our church, our youth leader took that course so that if any of the young people that she works with are thinking of those things. And it's as a school counselor, I was trained in that, but many people out in the community are not. And so Marianne has been working very hard on that, and Sarah Ellsworth from the ESD 113, and then Dixie Grunenfelder from OSPI. So they've formed very much of a connectedness group working on preventiveness. That doesn't always get to the why, but it is working on very hard on preventing people from suicide.
Did you have another question?
Yeah, you answered my second question about the mental first aid series or sessions, what they are. So thank you very much for that.
You're welcome.
And I'm not half but thrilled. I'm thrilled that it's a shame we have to talk about this, but I'm glad we did this in-depth piece on suicide.
Yeah.
Thank you very kindly.
You're welcome.
I guess I'd just like to say how fortunate we are to have people like yourselves that are willing, after your retirement, you know, forego the travel, whatever, do something near and dear to your heart and do it so well for our community. And if we had more people like yourself, we probably wouldn't have as many problems as we have today.
Thank you. What I will mention is, as Duncan said, there's 40 representatives from organizations, but we've opened it up now to just community members, and we have 120 people on our mailing list.
And our thanks go out to those participants as well,
Exactly.
very much so. I mean,
Yeah.
you happen to be here as the lightning rod to kind of show the flag, if you will, but it's impossible. These type of problems are not going to be solved by probably some government regulation. They're going to be solved by people that care.
People who care, and
people
are
who
working
care.
together in a community of care.
And I've been impressed with this group that the governor has put together. I participate in the phone calls, and there are these specialists in lots of different areas, hospitals and counseling centers from around the state that are part of this network that they've created, and they get together and they share ideas that they're working on locally, and so that's been a wonderful resource for us. And I mean, we look at our work, and then I look at what that network is doing, and they're out there in the trenches, and so people are addressing it, but it's a big problem, and it just blew us away when we looked at it and found out what proportion of gun deaths are associated with self-inflicted, and you just don't know about that. I mean, as I said before, you see the shootings on the street and everything, and that makes the headlines. And so you think that's the big problem. That's where the gun deaths are coming from. But it's suicide and people getting access to the tools to do that, and handguns being the most efficient tool to do that. So,
And the scary part is the desensitization. You know what I mean? We
Yes.
see it so much, we get desensitized,
Yeah.
and okay, it's no big thing. But thank you for what you're working at.
Duncan and Diana, we are grateful to you, and come back and tell us more and keep us informed, and we look forward to working with you in any capacity possible.
thank you.
Thank you so much for inviting
You
us.
bet.
And I just want to assure Gary that we still do some travel.
Very much.
Okay, good for you.
And thank you, Coroner Warnock.
Yeah.
Thank you.
Sure, come on up here.
Sorry about that. They talked about what suicides that, suicide doesn't make the media, period. What cases do you think do make media coverage?
The drive-by, the shooting.
Murder.
High-profile cases, people who jump off bridges, things like that. Those get reported on. What happens behind closed doors and in people's garages and everything else, the media has no idea, and nor does our public. They have no idea what is going on in our community. It's a taboo, hush-hush, and people don't like to talk about it. But if it's in a public setting, then it's talked about.
Yeah. That's
Yeah,
why
you're
we
right.
asked you, Mary Ann, and McQuarries to come here today so we can continue that conversation.
Okay. Thank you.
Thank you,
You bet.
Coroner.
Thank you, sir. All righty, the next item we have on our agenda is number item 5, which is the News Tribune Olympian Independent Contractor Freelancer Agreement, and I'll ask Mr. Art Story to frame it for us.
So this is just a kind of a small business item, and it has to do with the agreement that we have with the Daily Olympian, or the company that runs the Daily Olympian and the Tacoma News Tribune. And what it does is it just basically creates the relationship, or a contractual relationship between us and them for the news news columns that Dr. Wood publishes, or at least that we help her publish. And so this is just it's a renewable business agreement. We talked, of course, with any of these sorts of things, we have our prosecuting attorney review it, and they suggested that rather than just having Dr. Wood enter into the agreement on her own, that we bring this before you so that you could authorize it. And there's no money exchange or anything. It basically just establishes how many articles we produce. And there's one clause in there that says that when we for these articles that after they're submitted to the Olympian for publication, that we have to wait 2 weeks before we use them for something else. So it's kind of a small inconvenience, I think, for the great, basically the service that's provided and the opportunity that we have then to publicize our public health programs and the activities taking place. And so we're asking you to authorize this agreement today.
Any questions, comments?
Well, I'd just like to point out that it isn't very often somebody comes before the board and asks us to authorize something that doesn't cost the taxpayers anything, and thank you very much for what you're doing.
Just to allow someone to do public service announcements as you do.
Sure.
Good grief.
Well, it's the whole department, and we're also grateful to our media partners that it's a win-win situation for educating the citizens.
All right, with that, I'll entertain a motion.
Mr. Chair, I move to approve and authorize Health Officer Dr. Rachel Wood to sign the News Tribune and the Olympian Independent Contractor Freelancer Agreement for the duration of January 1, 2017 through December 31, 2017.
I'll second that.
It's been moved and seconded as stated. All those in favor say aye.
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 Aye. Motion carries. There you go.
Thanks.
You bet. So the next item we have is department items for legislative update. So I'm going to ask Mr. Art Story to do that, plus do the director's report at the same time.
Okay. So I just have this is Art Starry. I'm the interim Public Health and Social Services Director, and just have a few bills that I wanted to bring to your attention. I think you're aware of many of them, but I'll just highlight a few. One bill that I brought before you earlier that you've expressed an interest in is one that's called, or it has to do with something called Foundational Public Health Services, and there's a House Bill 1432 associated with that. And that's work that was actually a bill advocated by the Department of Health. And it's something where the Department of Health would work with local health jurisdictions to define what foundational public health services are. In other words, what the core public health services are that everybody in the state of Washington should expect. And they cover things like communicable disease, intervention, epidemiology, basic public health, or environmental health services. And so that bill is, again, before the House. I believe it may have been exec out of the first House committee is today. If not, it's scheduled for tomorrow. And if the bill is approved and in the governor's budget includes funding for foundational public health services, this would act as the mechanism where those funds could then be, or the uses for those funds could be identified. And it ends up being a real critical issue for us at the health department and other health departments across the state, because as a result of the funding cuts going back to 2008 and the staffing reductions, we really do struggle in a lot of areas like our epidemiology work. As good as Mary Ann is, and some of the other folks that we have working on epi programs, we need more of them. And so we struggle when we run into issues. And so this would provide needed funding for that if there's a funding that goes along with the bill eventually. So that's a key one. You mentioned earlier, Commissioner Hutchings talked a bit about medicines and making sure that medicines aren't getting in the hands of kids, because that can cause accidental overdoses and poisoning. There is a bill called House Bill 1047 that's trying to create a mechanism where safe medicine return a statewide safe medicine return program would be set up, and it would be funded by the pharmaceutical or basically the producers. So that bill has had a hearing. Looks like it may be modified. It may be scheduled for executive session out of its first committee this week. It's something that I think if it can be done properly, we would certainly support. Thurston County is fortunate to have a program where we have safe medicine returns, I think 7 sites in Thurston County, but they're being done largely by the law enforcement community. We've provided some boxes for them, but the management and the disposal of the medicine in those boxes takes place is done by the sheriff and some of our local police chiefs, and it takes effort and it takes money to dispose of things, so having a statewide program would be a good thing. It would help both in terms of trying to make sure that kids can't access stuff and that people don't steal things out of medicine cabinets and use them for improper uses. It also helps make sure that when medicines are disposed of, that they aren't contaminating the environment. So that would be an important thing. There's a couple of bills regarding septic systems. There's always bills about septic systems. One would have to do with requiring us to update our septic system management plan, but we have some concerns about that because while it's well-intentioned, there's costs associated with it and there's no financing provided. And so the State Public Health Association and the Association of Counties have voiced those concerns. There's also a bill that would raise the minimum age for tobacco and vapor products to 21, and there's information that shows that if children or if young adults can't access tobacco until they're 21, that basically the number of folks who end up using tobacco products is reduced, reduces the amount of stuff that gets passed down to younger adults and teenagers and things. And so there's a lot of good public health reasons for that, but as you can imagine, it's controversial. It also recommends that vapor products the minimum age for that be 21. So those are things that are being worked on and something that we're trying to track. Let's see. The other one that I'll just mention really quickly is that there's a bill that proposes to add a surcharge onto the hazardous substance tax that it's charged on oil and other products that are brought into the state. That tax came about in 1997 as a result of an initiative. And why we're interested in it at the county and at the health department is because that's used to fund some of the grant programs that we have for helping provide education and outreach for solid waste and hazardous materials. It actually funded those drop boxes for the safe medicine return several years ago. And and so now a surcharge is being proposed to help I guess, resuscitate the fund that's used to pay for those programs because it's been over allocated, and if there isn't additional funding for it, those grant programs would go away, which would be a big impact both to the health department as well as the public works department because some grants are made available to them as well. It also funds some stormwater things. So that's another one that this Washington State Association of Counties is monitoring, and they are supportive of that bill, but we'll see what happens because, of course, during this tough time in the legislature, when there's issues with revenue and funding of schools and things, that one probably might have a tough row to hoe to get past. So those are just a few highlights of bills. Oh, there's one other one that I should mention for our behavioral health organization. There is a bill called House Bill 1388 that might change the designation of the State Behavioral Health Authority from DSHS to the Healthcare Authority. The behavioral health organizations are concerned about how that may move and how that may impact how behavioral health organizations and whether counties can have them after 2020. So that's one that they're watching. I'm not an expert on that one, so don't ask me any questions. I'd probably get confused.
We don't want it.
So those are the ones I just highlighted. Any ones that you're aware of that you might? I have my big bill list in case. But.
No, that's a good rundown, though.
Okay. So I can talk really quickly about a few things that might be of interest. Commissioner Hutchings yesterday was with me and our housing staff along with folks from city councils and from the United Way for the Community Investment Partnership Retreat that was yesterday. And that's really important because that's a way that funds are distributed to a lot of our community partners for things like housing, programs to help advocate for healthy food and local food infrastructure, other things that actually help move forward with some of the Thurston Thrives agenda. So the group, and Commissioner Hutchings probably could provide a lot more details on this, but they were trying to identify what they thought were priority projects so that when applications come in for those funds that they can make the best investment possible through a variety of things, including everything from United Way contributions to state and federal grants and funds that are collected as part of that the auditor collects for filing fees. There's going to be about $4.5 million available in 2017, and there's a grant program that is administered by the county, and the application period for that will probably start about the beginning or the end of next week. We'll actually have online applications, and so folks who are interested in that could look at our county website and go to the housing page, and they'll be able to submit applications there, and they'll have about 6 weeks to submit applications. The housing folks have done some really good work as far as creating an online application process, so that's actually going to allow more time for the applications to be submitted and reviewed. It will take less time, we think, for the folks to review them because of that electronic process. So that's good news. Regarding behavioral health related items, Mark Friedman wanted me to tell you that since the triage center over at the Accountability and Restitution Center, or the jail, has been set up, there's probably been 100 folks or more who've been diverted to proper treatment who otherwise would have gone into jail. And as you folks know, and maybe the I'm not quite as much an expert on this, but the triage center opened in about September. And the idea is to provide a way for folks who've come in contact with law enforcement officers to be evaluated to determine their mental health needs and things. And what happens is, before this, a lot of folks would go to jail and when in fact they needed other sorts of treatment. So this allows them to be evaluated and appropriate ones to be diverted to appropriate treatments or other ways rather than just going into jail. So that's really good news, and it's both provides the best treatment for folks, and it's also more cost effective than having people stay in jail when there are other methods that would be effective in helping them deal with their difficulties. So that's one thing. And the last thing I'll brag about a little bit is something called Grow Smart, Grow Safe, and that's a program that helps people. Excuse me. It's a guide for outdoor lawn and garden products, and it's a program that's been going on in the state for a while, but recently the department was able to receive grant funds so we could set up a website to provide information to people online, and so that website just went live a few days ago. Our public information officer sent out a news release, and Commissioner Blake was nice enough to lend a quote to that, and so I think it provides really good information to the public about how they can manage different pests and weeds and bugs and things, and do that in the safest way. It provides everything from recommendations that don't involve pesticides at all to helping people make choices that use the least toxic and most effective products. So it's, again, trying to provide information to the public so they can make the right decision. And it's based upon stuff that was actually developed by Thurston County to implement our integrated pest management program. So we've had staff who've done a very good job as far as reviewing information on pesticides and other lawn care products. That was something that we're now making available to the public, and it's being well received. So I just want to talk about that. So if you go into your web browser and you type in Grow Smart, Grow Safe, you'll probably you'll be able to find the website. You can click on it and you can see it. And what's really cool about it is it works really well on everything from your phone to your laptop computer to your desktop. It's designed so it works well no matter what you're looking at. So I'll just leave it there. Those are a few director's items. There's many more things, but those are some highlights.
Busy, huh?
Wow. Great, you're right.
Yeah, Commissioner Edwards has a question for you.
Excuse me?
He has a question.
Okay, yes.
We publish something called Talking Trash.
The county does, yes. That
Yes.
comes from the Public Works Department is the key for that, but the Health Department also contributes articles. I think we have a page when it gets published.
You contribute
Yes.
articles, I take it. I've just got a question. When you talk about pharmaceutical disposal, I noticed that Olympia is not in the list. Is there a reason for that?
It's because we've asked them to participate and they've chosen not to for whatever reason. I can't tell you why.
So am I to figure that a lot of pharmaceuticals are ending up in lot that get flushed down the toilet and such?
I think I think that is a concern, is that if you don't have safe collection sites, if they're not readily available and convenient, that people will do things like flush things down the toilets or dump them in the garbage or other thing like that. And so if there's not a convenient site in Olympia, that means they would have to come up here to the courthouse or someplace else. So that is a concern. But yeah,
have we ever written them a letter from the health department to
our
ask
staff
them to participate?
has asked, and I don't know why they chose not to participate. I could dig that up if you'd like. But we've asked
I would think that
multiple
we'd
times.
probably sign a letter. I don't know what my other board members say, but I think it's a pretty important piece of the puzzle.
Even down in Tenino and Rainier, those get
doing it.
filled.
Tenino, Rainier,
They
Yelm.
fill them routinely.
I know the other jurisdictions are
I
utilized
can
heavily.
imagine what Olympia's would be.
Yeah, the corner even has one. So we've got, we've tried. We could try again if you'd be happy for your assistance.
Well, I'd
happy
be
to have
willing
your
to sign a
assistance.
letter asking them myself, and I don't know if we need to take a board action on that, but I think rather than coming from you, if you've already tried it and that's not worked.
So
would
what
certainly
I
sign
can
off
do
on
is the staff person who worked on that, I'll check with him to find out what the latest efforts was, and then I can come back to you and we can figure out what might be effective.
I would hope that throughout the Puget Sound that it's being utilized everywhere, because I know up in Victoria it's flushed straight into the Strait of Juan de Fuca and right down into the Puget Sound area with no treatment. No, just think of the tons of pharmaceuticals that are put into our water.
I mean, and
along
that's,
with the
again,
trash.
that
other
gets back,
stuff.
yeah, it gets to that one bill, because
Big
even
problem.
with our 6 or 7 sites, most people would say that's not nearly convenient enough. So that's the impetus behind that bill. So.
Okay, let's move to the health officer's report.
Hello. I'm going to talk a lot about infectious disease. So I wanted just to let you know, I think most of our partners and I'm hoping the community is aware that influenza has been a little bit more violent this year than it was, say, for instance, last year. And it has stressed the healthcare system. And I could talk at length about that, but I'd be happy to answer any questions. I just remind people to, if you haven't had your flu shot, please go get one. Cover your cough, stay home if you're sick. There are plenty of other respiratory viruses out there, and I think that there are now lab tests for detecting things like respiratory syncytial virus and other type viruses. I'm not sure that we're seeing more than in previous years, but we're now able to test for those. So you may hear about people who have flu-like symptoms, but it's another virus. Mumps is spreading still throughout our state, and again, I would encourage people, if they are not up to date on their measles, mumps, and rubella shots, please do go get that. It is still better to have that shot than not have it, and especially if mumps comes to your workplace or your school. We would hate for you to be susceptible and need to be excluded from school or work because you hadn't had your MMR. We still have people who unfortunately have tuberculosis, so just wanted people to be aware of that, and we continue to work with our healthcare partners to manage that, diagnose it, and take care of the individuals who have that and who may have been in contact with others. And finally, just to say over and over again, partnerships are invaluable. We had a meeting just last week of individuals from 5-county area for emergency preparedness and response, and people coming from some of the 8 hospitals in the region. After the problems that we had with Ebola in 2014 and 2015, we're trying to have our healthcare system be ready for Ebola or other special pathogens, not just Ebola, MERS, a novel influenza virus, or just a couple of others. So we had a meeting and we did a workshop about, what personal protective equipment is available on site and how an individual might be transported to a treatment hospital in the state. So, thank you very much.
Thank you. Any questions?
No, thank you very much,
No,
Doctor.
thank you. Thank you, Doctor.
Marvelous. Thank you, Doctor. Okay, with that in mind, I'll take a motion to adjourn.
Mr. Chair, I move to adjourn the Board of Health meeting of February 14, 2017.
I'll second that.
It's been moved and seconded to adjourn the Board of Health meeting for February 14, 2017. All in favor,
Aye.
say aye.
Aye.
Aye. Motion carried. We're adjourned.
Thank you.